When it comes to improving transparency regarding the problem of abuse and neglect in our nursing homes, is a prominent consumer stop sign really the best way? Hi, I'm Chris Laxton, Executive Director of AMDA, the Society for Post-Acute and Long-Term Care Medicine. As I'm sure you know, the Centers for Medicare and Medicaid Services recently added a red hand consumer alert icon to the Nursing Home Compare website. The icon, an upraised hand and a red circle indicating stop, identifies skilled nursing centers that have received an abuse or neglect citation within the previous year. Patient or resident harm from abuse is never acceptable, and we must acknowledge that some nursing homes do not have adequate protections against patient abuse. However, we're concerned that CMS's decision to use the red hand icon could result in outcomes that are counterproductive to achieving the high-quality care for which our members strive. So recently, we sent a letter to CMS Administrator Seema Verma to share our concerns, including feedback from members and our state chapters. Here are some of the points we raised in our letter. First, it is a fundamental patient safety principle that healthcare facilities must establish blame-free environments to encourage the openness that healthy workplaces strive for in order to proactively identify and correct deficiencies. The Agency for Healthcare Research and Quality, or AHRQ, has spent hundreds of millions of taxpayer dollars to establish a patient safety network responsible for education, training, and the promotion of systematic approaches to prevent adverse events, including abuse and neglect. Central to this mission is AHRQ's message that healthcare facilities establish blame-free environments. By assigning blame without context or explanation, the red hand icon clearly violates this principle. According to W. Edwards Deming, one of the fathers of quality improvement, ensuring a just culture is critical to engaging teams in efforts to prevent patient harm as well as to improve quality. The red hand icon erodes CMS's own efforts to promote quality improvement in nursing homes. This approach may actually result in a reduction of abuse reporting, as a culture that applies penalties in response to problems are more likely to see those problems increase. And unlike the large body of evidence that I've just discussed, the red hand approach was not tested prior to its rollout and is not evidence-based. Furthermore, we're well aware that the survey process, which is the mechanism that will generate the red hand icon, remains highly variable, subjective, and in some cases inaccurate. Additionally, the red hand icon is already having the effect of undermining preferred skilled nursing facility networks that have been established by accountable care organizations and other groups. Preferred post-acute networks are carefully chosen and cultivated in a mutually beneficial manner to the patient, the facility, and healthcare organization. With this icon, however, an ACO is caught in a quandary. A SNF with otherwise very good ratings and a long history of good service may have a single abuse citation caused by a single individual that is subjective to each survey team. This then places a red hand on the nursing home that produces otherwise excellent patient outcomes. The ACO is now forced to consider excluding the facility from their post-acute network and using otherwise lower quality facilities, which may in turn negatively impact many patients instead of just one, potentially also jeopardizing the fiscal integrity of the ACO. As AMDA and other stakeholder organizations have been saying now for some time, a public registry of nursing home medical directors would be a useful resource for the consuming public to gain a greater understanding of the latest developments and issues with nursing homes, including concerns about abuse and neglect. Medical directors have important roles as problem solvers and credible information sources when patients and families have such concerns. And yet, sadly, as a recent JAMDA editorial clearly outlines, the medical director often has little to no relevance in the quality of nursing home care, including in the prevention of abuse and in understanding what an abuse citation means in the context of a specific nursing home. The red hand icon simply adds to this unfortunate gap in quality oversight. As advocates for post-acute and long-term care patients, residents, and families, we want to work with CMS and other stakeholders to help create and implement effective strategies for reducing neglect and abuse in nursing homes. we feel strongly that the red hand icon should not be one of those strategies. Instead, we urge CMS to adopt a more productive approach, such as those we've discussed here and in our letter. You can find a copy of our letter to CMS on our website, paltc.org. You can also find the active press coverage the letter has received under the Society in the News section of our homepage. If you have thoughts on this important issue, or anything else for that matter, please send me an email at executivedirector@paltc.org. I look forward to hearing from you, and thank you.